okay, that make up the walls of the follicles. And again, if you get a point on this thing, don't call it a follicle cell. That's the follicle. The follicle cells make up the walls. Okay? You can see it here, roughly. See if you can focus. These little dots that you see here, these are the nuclei of the follicle cell. The whole structure then is the follicle. Again, it's these follicle cells that produce T3 and T4. It's stored within the follicle in complex with a protein, and that is known as you might want to look at your handout, follow along on that. Okay. Thyroglobulin. That's what we have on handy. So, we'll follow along on that. Okay. This is page 14, where it says functional anatomy of endocrine glands. Under thyroid gland, okay? Thyroid follicles, thyroglobulin. Thyroglobulin, again, is that protein, okay? Complex that holds the T3 and T4. That's where it's stored, and when it's needed, it's released into the blood. Now, what do T3 and T4 do? They basically regulate what we call your basal metabolic rate. In other words, oxygen use, cellular metabolism, breakdown of glucose and fats, metabolism, protein synthesis, growth and development. Everything else, in fact, what goes on in the body, T3 and T4. Often as people get older, they have problems. Either they don't produce enough T3 and T4 or they produce too much. If they don't produce enough, that's hypothyroidism. They usually go on drugs, they take them regularly to maintain a proper level of thyroid hormones. If they produce too much, then you've got a problem, because what this does is speed up your basal metabolic rate. You burn calories very quickly. You lose weight, that sounds good, okay. But what's not good is it can speed up your heart, actually puts you into tachycardia, which can be very dangerous. Also, you have trouble thermoregulating because you're burning calories so fast, your metabolism so high, you're hot all the time. And then you got three options. You can take a thyroid hormone antagonist to reduce production of T3 and T4, or you can have the thyroid surgically removed, or they can implant I-131, a radioisotope, that's taken into the thyroid because the thyroid uses iodine to make the thyroid hormones. The problem with that is you radiate, literally. And you can't be around other people when you zap their thyroid, especially children. What I tell you to do is get away from your family. It's better if you stay in a motel when you can be in the same house. If you do, you should sleep separately. Don't hug your children, your wife, spouse, whatever. You can zap their thyroid as well. You should use separate utensils, wash your clothes separately, and so on. So a period of time you are a pariah until they zap the thyroid. So, not a very good prospect, but that's what sometimes happens. Okay, so T3 and T4 regulate your basal metabolic rate. Okay, how fast you burn the calories, your oxygen use, your breakdown of fats, and glucose, protein synthesis, and so on. All right, there are also some other cells in the thyroid called parafollicular cells. And they're the tissue here between the thyroid follicles. You can see the nucleus all over here. These are parafollicular cells. They produce another hormone called calcitonin. That's at the bottom of your hormone handout, calcitonin. What calcitonin does, it lowers calcium ion levels in the blood. It inhibits osteoclast activity. You may remember when you were studying bone, you have cells that lay down bone matrix, the osteoblasts, as a B as in boy, and the osteoclasts, which chew up the bone matrix. By inhibiting those cells, You can basically take calcium out of the blood, lay down the calcium and calcium salts as part of your inorganic bone matrix. So again, they lower calcium ion levels in the blood, calcitonin. So it takes calcium out of the blood and encourages the deposition of calcium salts in the inorganic bone matrix. That's calcitonin. Don't confuse it with calcitriol, which is vitamin D3. Okay, so those two types of cells there. Parafollicular cells in the tissue here between the follicles and the cells that make up the wall of the follicles are the follicle cells. Follicle cells produce T3 and T4. Parafollicular cells produce calcitonin. Any questions? Okay. Now, we also have little lobes of tissue which are surrounded by the thyroid, and these are the parathyroid glands. On this slide we have one right here. And you can see it looks distinctly different than the thyroid. The thyroid has these big follicles all over the place. Parathyroid looks rather granular in appearance. It's full of these little cells, which unfortunately are called chief cells. Where do you see chief cells before? When we use that term? And the gastric glands in the stomach, remember, they're the ones that produce the hormone, not the hormone, the digestive enzyme, pepsinogen, converted to pepsin by the hydrochloric acid of the carnal cells. But unfortunately, these are called chief cells. What you see here, given it granular appearance, are the nuclei of these chief cells. And they produce parathyroid hormone. Parathyroid gland, parathyroid hormone, produced by these chief cells. And their function is the opposite of calcitonin. Look at the top of the next page of your handout, parathyroid gland, parathyroid hormone. Okay, from the chief cells, this elevates calcium ion levels in the blood. It stimulates osteoclast activity. These are cells again that break down the inorganic bone matrix, so it puts more calcium ions in the blood. It also stimulates the kidneys to reabsorb more calcium ions, also to absorb more calcium from the food in your intestine, and also to form calcitriol, which is vitamin D3. As you probably know, vitamin D is needed for the absorption of calcium. Often if you have a vitamin D deficiency, you've got a calcium deficiency as well, especially in children. That's why it's so important that children have adequate not only calcium in their diet, but also vitamin D. And this is also why many dairy products are fortified. Milk, cheese, cottage cheese, yogurt, and so on are fortified with vitamin D, usually A as well. But of course, major hardening agents of your teeth and your bones are calcium salts, calcium phosphate, calcium carbonate. But again, this is calcitriol, not calcitonin. Calcitriol is vitamin D3. Now, you've heard you lay out the side and you get vitamin D. Then you get a precursor of vitamin D. That's carried to the kidneys. The kidneys actually make the vitamin D3, which is the more effective form of what you get from laying out the sun. Okay. All right, so again, parathyroid hormone elevates calcium ion levels in the blood. It encourages breakdown of calcium salts in the bone matrix by encouraging osteoclast activity, causing kidneys to reabsorb more calcium ions from the renal filtrate, stimulates production of calcitriol, vitamin D3 by the kidneys, and thus absorption of more calcium from your food, from your intestines. The overall effect, elevate calcium ion levels. Calcitonin, lower calcium ion levels. Calcitonin produced by the parafollicular cells in the thyroid. Chief cells produce the parathyroid